We'll look at the concept known as what Pouchitis. Pouchitis. Now, Pouchitis is actually an inflammation of the ileal pouch. Okay, so there might be different causes of this inflammation of the ileal pouch, but one of the most common causes is a surgical complication. All right, so probably a proctocolectomy where the rectum was removed, right? A surgery in which the rectum be removed. Okay, so now like the ileal pouch is kind of like what is now having direct connection with the sphincter. Okay, so normally this is usually due to what the complications of this surgery. That's the proctocolectomy. Okay, so talk about the concept of this pouchitis. All right, so from the definition, we say that pouchitis is the inflammation of the ileal pouch, which is a complication of restorative what proctocolectomy. Okay, it's not always, but it's usually due to that. Okay, so what are the types? You go have acute pouchitis, we have chronic pouchitis, we have recurrent pouchitis. Okay, acute, that means it's starting all of a sudden. Chronic, the inflammation has been there for a very long time. Right, causes. Right, this is due to what? Alteration of gut microbiota, because you know that in the gut you have those what resident, what do they call it, resident flora, normal flora. Okay, so if there's an alteration, they can actually cause an inflammation. That's a disease condition. It could be due to ischemia, it could be some infections like from bacterial, virus, fungal. It could be due to inflammatory bowel disease, it could be due to what irritation from stool or bacteria. All right, so this was just the surgery. Okay, so if they remove the rectum, then they have to actually what connect the ileal pouch. Okay, like do like they will now make the ileal pouch big to serve as the rectum. Okay, so inflammation of the ileal pouch usually what occurs here. Right, that's a complication. Symptoms. Right, there'll be diarrhea. Okay, passing out watery stool. There's abdominal pain. There's rectal bleeding. There's urgency. There's what fever. There's fatigue. Then diagnosis, you can actually confirm this using an endoscopy. You could still take some biopsy. There's stool tests. Then some imaging studies like CT scan, MRI scan, and Pouchoscopy. Wow. All right. Then treatment. Use antibiotics just to prevent what infections. You use what anti-inflammatory medications, immunomodulators. Then surgery in some severe cases. Complications, this could lead to chronic pouchitis, lead to pouch failure, lead to dysplasia, lead to cancer, lead to perforation. Okay, so that's it for the concept of pouchitis.